Hi everyone, I'm Dr. Ansuman Matthew and I'm a registered pharmacist. Today I would like to make you all aware regarding PTSD. PTSD stands for Post-Traumatic Stress Disorder. So post-traumatic stress disorder is a psychiatric disorder that can occur in people who have experienced or witnessed a traumatic event such as a natural disaster, a serious accident, or a terrorist act, war, rape, or other violent personal assault. Most people who go through traumatic events may have temporary difficulty adjusting and coping, but with time and good self-care, they usually get better. If the symptoms get worse, last for months or even years, and interfere with your day-to-day activities, then you may have PTSD. Post-traumatic stress disorder symptoms may start within 1 month of a traumatic event, but sometimes symptoms may not appear until years after the event. These symptoms cause significant problems in social or work situations and in relationships. They can also interfere with your ability to go about your normal daily task. Symptoms of PTSD fall into 4 categories, and they are: first one is the intrusive thoughts, second one is the avoiding reminders, third one is the negative thoughts and feeling, and the fourth one is the arousal and reactive symptoms. Intrusive thoughts include the repeated involuntary memories, distressing dreams or flashbacks of the traumatic event, and the flashbacks may be so vivid that people feel they are reliving the traumatic experience or seeing it before their eyes. Avoiding reminders of the traumatic event may include avoiding people, places, activities, objects, and situations that bring on distressing memories. People may try to avoid remembering or thinking about the traumatic event. They may resist talking about what happened or how they feel about it. Negative thoughts and feelings may include ongoing and distorted belief about oneself or others, ongoing fear, horror, anger, guilt or shame, much less interest in activities previously enjoyed, or feeling detached or estranged from others. Arousal and reactive symptoms may include being irritable and having angry outbursts, behaving recklessly or in a self-destructive way, being easily startled, or having problems concentrating or sleeping. Many people who are exposed to a traumatic event experience symptoms as mentioned in the days following the event. For a person to be diagnosed with PTSD, however, symptoms should last for more than a month and often persist for months and sometimes a year. Many individuals develop symptoms within 3 months of the trauma, but symptoms may appear later. For people with PTSD, the symptoms cause significant distress or problems in functioning. People of all ages can have post-traumatic stress disorder. The most common events leading to the development of PTSD include combat exposure, childhood physical abuse, sexual violence, physical assault, being threatened with a weapon, or an accident. Many other traumatic events can also lead to PTSD, such as fire, natural disaster, robbery, torture, kidnapping, life-threatening medical diagnosis, terrorist attack, and other extreme or life-threatening events. After surviving a traumatic event, many people have PTSD-like symptoms at first, such as being unable to stop thinking about what's happened, fear, anxiety, anger, depression, guilt. All are the common reactions to trauma. However, the majority of the people exposed to trauma do not develop long-term post-traumatic stress disorder. So getting timely help and support may prevent normal stress reactions from getting worse and developing into PTSD. This may mean turning to family and friends who will listen and offer comfort. It may mean seeking out to a mental health professional for a brief course of therapy. To raise awareness on post-traumatic stress disorder, a mental health problem that may develop after a person has been exposed to one or more traumatic events. Share your knowledge with others and promote PTSD awareness via social networks and reach out to help those who need it. Thank you for listening. Stay safe and stay healthy, everyone.